Welcome back to the deep dive. Okay, so in a world just constantly flooded with new health products, right? All promising the ultimate shortcut, it's really easy to get swept up.
Oh, absolutely. Especially with weight loss. It's such a common goal.
Exactly. There's always some new breakthrough, some revolutionary formula. Today, we're trying to cut through that noise. We're taking a deep dive into one product that's been making waves. Lercea Meglutide
Oh,
drops.
yes, or sometimes called Lercea Meglutide oral solution. Seen that one too.
That's the one. So, our mission, like always, is to really dissect the claims, look hard at the supposed backing, and figure out from our sources if this is a real advance or, well, something else.
Something less substantiated, perhaps.
Precisely. We're here to help you figure out what's real and what's just ambitious marketing.
And it's so important. What's fascinating here, I think, isn't just the product itself, but how cleverly these things tap into genuine concerns. Health, body image.
Mm.
The language is persuasive.
So persuasive.
Right, so understanding the actual evidence, or maybe the lack of evidence, is just crucial for you, our listener, to make smart choices. It's about looking past the shiny label.
Couldn't agree more. So let's start with the promise. What are Lercea Meglutide drops actually claiming to do?
Well, they pitch it big.
They really do. It's hyped as a breakthrough fat-burning formula,
Mhm.
claims it helps melt away visceral fat, that's the dangerous internal fat, just so everyone knows, and curb your appetite. Standard stuff, maybe.
Kinda, but then they ramp it up.
Yeah, they don't stop there. The claims get bolder, preventing chronic diseases, for instance.
Which is a massive claim for any product, let alone drops.
Huge. And here's where it gets really interesting. It's marketed as a safer, quicker alternative to drugs like Ozempic and Wegovy, the big prescription names.
That's a direct challenge, essentially.
It is, and they add that it was supposedly developed by top U.S. medical institutions using a natural GLP-1 based compound. Now, GLP-1s, those are legit hormones involved in appetite and blood sugar.
Uh-huh. That's why the real drugs work. They target that pathway.
Right, so this product is basically saying, we do that too, but naturally, safely, and without a prescription. Sounds like a dream, doesn't it?
Yeah.
Almost too perfect.
And usually when something sounds too perfect in this space, it warrants a closer look. If we put these claims against how real science works,
Mm.
the rigorous research, the trials,
Mm.
red flags pop up fast.
Okay, so let's get into those red flags. What did the sources find?
Okay, first, big claim. Developed by Yale School of Medicine. Sounds impressive.
Very. Yale carries a lot of weight.
It does. But the source looked into it thoroughly and found, well, nothing. Zero evidence. No published studies, no clinical trials, not even a press release from Yale backing any of this up.
Wow. So just a claim with no substance behind it.
Seems like it. It's a major credibility gap right off the bat.
Hmm.
Then there's the supposed endorsement from the American Public Health Association, the APHA.
Okay, another reputable organization.
Exactly. But our source calls this one super sketchy. And the reason is simple. The APHA doesn't endorse commercial products ever, period.
Ah, so that's just not something they do.
Never. It's against their policy.
Yes.
So claiming their endorsement, it just doesn't add up. It really makes you question the whole approach, doesn't it?
Hmm.
Using these trusted names without any actual connection.
It feels intentionally misleading, trying to borrow that credibility.
That seems to be the tactic. Leverage the name, hope nobody checks too closely.
Okay, so the institutional backing seems shaky at best. What about regulatory stuff, like the FDA? Does it give the impression it's approved or anything like that?
Yeah, it definitely walks that line, giving the impression it's somehow in the same league as legitimate prescription meds.
Hmm.
People might naturally assume there's some kind of official oversight if it's making health claims.
Right, you'd hope so. So what's the reality there? Is it FDA approved?
The source is crystal clear on this. It's not. Unequivocally, no FDA approval.
And that matters because...
Because FDA approval means rigorous testing for safety, for effectiveness, for consistent manufacturing. Without it, you have none of those guarantees. It's a huge missing piece for consumer protection.
Okay, so no FDA safety net.
None. And more specifically, the source points out there's no FDA-approved oral version of semaglutide available over the counter. Semaglutide, that's the actual drug in Ozempic, and Wegovy is prescription only.
And definitely not in drops you can just buy online.
Exactly. It's only available via prescription, usually as an injection, sometimes a tablet, but never as these kinds of drops. So the product's form, its availability, directly contradicts how the real regulated medication works. Big red flag.
That feels fundamental. It's not just a missing piece of paperwork, it's a completely different category of product presented as something it isn't.
Precisely. It takes it out of the realm of legitimate medicine immediately.
Okay, so if the backing is questionable and the regulatory status is non-existent, let's talk ingredients. What do they say is in these drops? They mention a patented form of meglutide derived from cyamethicone. Sounds very technical.
It does sound technical, very scientific. That's often the point. Use complex names to imply advanced research.
Right. So what are these things, really?
Well, our source broke them down. Let's start with cyamethicone. Turns out it's just an anti-gas medicine.
Anti-gas, like for bloating.
Literally. It's literally what you take for bloating. Our source emphasizes it has nothing to do with weight loss or metabolism. Nothing proven, anyway.
So they've basically taken an indigestion remedy and are calling it a weight loss ingredient.
It certainly looks that way.
Right.
Rebranding something common and unrelated for a completely different purpose.
Okay, that's surprising. What about the other one, meglutide? That name sounds awfully familiar.
Doesn't it? Very close to semaglutide.
The actual drug ingredient.
Exactly. And this seems deliberate. Our source suggests meglutide doesn't seem to be a real compound. They think the name was likely made up to mimic semaglutide to ride the hype train.
Wow. So potentially just a made-up word that sounds like the real thing.
That's what the analysis points to. It's a tactic to create confusion, to make you think it's related to the effective prescription drugs, leveraging all the buzz around them. But it's likely just a name.
So to recap, questionable backing, no FDA approval, one ingredient is for bloating, and the main active ingredient might not even exist.
That sums up the core issues pretty well, yes.
And yet they're not just claiming weight loss. They're going further, right, into some really serious health territory.
Oh yeah, they don't stop at trimming your waistline. They're claiming things like cardiovascular disease prevention.
Which is huge.
Massive. And even lymphatic stagnation, which, as the source dryly notes, what even is that in this context for a drop like this?
Right. What does a lemon peppermint drop have to do with your lymphatic system or preventing heart attacks?
Exactly. These are serious medical conditions. Cardiovascular disease is a leading killer worldwide. Lymphatic issues can be complex and indicate underlying problems. These need proper medical diagnosis and evidence-based treatment.
Not drops containing anti-gas meds and a maybe fake compound.
Precisely. The disconnect is just vast. Treating such serious conditions with this, it stretches credulity to the breaking point. It really preys on people's genuine health fears.
Okay, let's pull this all together then. After digging through all this, what's the final takeaway from our source on Lercea Meglutide drops?
The conclusion is pretty stark. The source states that while it might not be a straight-up scam, in the legal sense, maybe, it's absolutely surrounded by red flags.
Just red flags everywhere.
Pretty much. The claims are way over the top. There's zero real science or reputable medical backing. And it's playing a little too loose with the truth for comfort. It really feels like, an attempt to cash in on the buzz around real weight loss drugs without any of the actual substance.
Building a house of cards on someone else's foundation, basically.
A good way to put it. And we see this pattern, right? A real breakthrough happens, and suddenly the market is flooded with look-alike products making similar but unsupported claims. It's opportunistic.
So for you listening, if you come across products like this, making these huge promises, what's the practical advice?
This raises the key question. What should you do? The source offers very clear, very sensible advice. If you're looking at trying something like this, talk to your doctor first.
Simple but essential.
Absolutely.
Yeah.
Your doctor knows your health history, can evaluate claims critically, and knows about the legit options out there. There are evidence-based treatments for weight management and related conditions. Seek those out. Don't rely on something with this many question marks.
Sound advice. Your health deserves actual medical guidance, not just slick marketing.
Exactly right. Prioritize verified information and professional advice.
Well, thank you for walking us through that. It's a really clear example of why we need to be critical consumers, especially with health products. So thank you for joining us on this deep dive. It really highlights the importance of asking questions when something sounds a bit too perfect.
It really does.
Next time you hear one of those breakthrough claims, maybe pause and ask yourself, what are the real ingredients here? Is there any actual scientific backing? And maybe, who really benefits from all this hype?
What's fascinating here ultimately isn't just this one product. It's how easily appealing language and the promise of a quick fix can sway us, especially when we feel vulnerable about our health. Your best defense, informed skepticism. Always, and talk to your doctor. Stay critical, stay curious.